So my name is Dr. Emily Rule, and I'm a pelvic floor physical therapist. I am the owner of Wings Physiotherapy, and today we're just going to do a quick webinar to talk about nutrition and how it can impact the pelvic floor. If you guys have any questions, just put them in the chat box and I'll answer them, or you can just unmute yourself. There's not very many of us on here, and I can answer it that way. So to start, I just want to say that this is not medical advice and it's for educational purposes only. If you feel like you're having issues either with the pelvic floor or with nutrition, it's important that you seek advice from a licensed healthcare provider, whether that be a physician, a physical therapist, a registered dietitian. If you need any help finding any of those people, I'd be more than happy to help you find somebody in your area. Just let me know. So to start, let's talk just very briefly about what the pelvic floor is, because I think it's important to understand what it is and what it does in order to be able to understand how nutrition is going to impact it. So the pelvic floor is essentially a big group of muscles. There's about 17 different muscles. It's not just one. So this picture here is looking down kind of into the bowl of the pelvis. So at the top here, you've got your spine, and then you've got your hip bones that surround it. These coming at the bottom would be your femur or your thigh bone. So the pelvic floor sits and it's got 4 different functions. So it's going to support all of the pelvic organs. You can see here, you've got your rectum, your uterus, and your bladder. So the pelvic floor muscles actually work kind of as a hammock to help support all of those muscles. If you guys can see this here, all of the pelvic organs would sit in there, and the pelvic floor, the red part, acts as that hammock to help support so that it doesn't fall out of the pelvis. The pelvic floor also plays a big role in stability as part of your core. So a lot of times when we think of our core, we think of our abs and our six-pack muscles. While that is part of it, there's a lot more to the core than just that. So you do have your abdominals, but then the pelvic floor works as part of the core. You've got your diaphragm, which is your big breathing muscle that sits under your ribs, and then also your back muscles. So all 4 groups of those muscles have to work together in order to provide stability for that core that we always talk about. The third thing that the pelvic floor does is it works as a sphincter. So a sphincter is essentially just a fancy word for like enclosing. So as you see, the pelvic floor muscles actually kind of wrap around the rectum, the uterus, and the bladder or the vagina, not the uterus, and help to close off all those holes. So when you have a stool in your rectum, those pelvic floor muscles have to stay closed so that poop doesn't just fall right out. Same thing with the bladder. If your bladder's full of pee, the pelvic floor muscles need to stay closed so that we just don't leak continuously throughout the day as our kidneys create that pee. Vice versa, the pelvic floor muscles also need to be able to relax to let things out when we're ready. So that's the sphincteric portion of what the pelvic floor muscles do. And then they also play a role in sexual function. Oops, I just lost my earring. So let's talk about look at the anatomy of the pelvic floor. This is if I cut you in half and looking at you from the side. So here in the front, you've got your pubic bone. This is going to be the abdominals that attach in the front. The pelvic floor muscles are this red part that span all the way from the pubic bone to your tailbone in the back. You've got your butt muscles here. And then in between, you see all of these organs. So you've got your bladder here, you've got the uterus and the vagina, and then the rectum. So let's talk a little bit about the bladder. The bladder likes water. So a lot of times when we're having issues either with needing to go to the bathroom a lot, getting a strong urge to go to the bathroom, we think, oh, let me drink less water because drinking less means I'm going to need to pee less. That's not always the case, because as we drink less, our pee becomes more acidic, and our bladder doesn't like that. The lining of your bladder is essentially this big ball of muscle, and it's lined with some cells. And when there's something really acidic in there, the bladder wants to get rid of it right away. So drinking less means that's going to be more acidic, and the bladder wants to get rid of it as soon as it can. So if you're having those symptoms, it's important to stay hydrated. Now, that's not to say if you're drinking nonstop all day long, you're not going to need to go to the bathroom. That is true. But knowing and managing your symptoms, if you're dehydrated, that can also make you need to go to the bathroom more. So typically, we want to shoot for about 48 to 64 ounces of water every day. Obviously, if you are doing things that are active and you're sweating a lot, you're going to need to take a little bit more water than before. Let's see. I see there's a question here. Liberty, I'm not sure what you're asking about. What is HEDS? If you want to just unmute yourself.
It's Ehlers-Danlos syndrome, hypermobility.
Oh,
Because people with hypermobility hips and pelvic floor, I'm wondering if that's common.
yes, it is very common for people that have Ehlers-Danlos syndrome to have issues with their pelvic floor, especially things like prolapse or problems where the pelvic floor isn't weak enough, just because we have a lot of that connective tissue that's just a little bit more stretched or a little bit more pliable than normal.
Thank you.
Yeah, you're welcome. Okay, so back to the bladder. So we want to stay nice and hydrated so that we don't have a lot of that acid in the bladder. With that said, what we put in our mouth or into our bladder can also impact it. So it's not just the amount, but it's kind of what you're putting in there. I do want to say with this stuff, this isn't to say that anything on this list is something that you can never have. But it's good to know so that if you are having urinary symptoms, whether you're having to go to the bathroom all the time or you're leaking, this can just help you to learn how to manage your symptoms. So obviously, coffee is a big bladder irritant. Most people, when they have a cup of coffee, they need to go to the bathroom after. So things like caffeine, artificial sweeteners is another thing that can be pretty irritating because it can make your urine pretty acidic. So if you think about if you're having a coffee in the morning and then you're putting an artificial sweetener in there to sweeten it, that'll just make it that much more acidic, and that can cause more of those urinary symptoms. Other things that can be irritating to the bladder are going to be alcohol, carbonated beverages, whether that be a soda, a diet soda, sparkling water, processed foods like sandwich meats or frozen dinners, spicy foods, things that have tomatoes or tomato products. So, the pizza sauce, pasta sauce, the marinara, ketchup, anything red. Vinegar can be acidic, pickles, certain fruits like citrus, so orange, lemon, lime, grapefruit. Some of these things are things that we like to drink in the morning, knowing that if I have a big glass of orange juice or if I add lemon to my water, that actually might make my urine more acidic and make me need to go to the bathroom more often. And then foods that are high oxalate. So oxalate is a compound that's found in food, and normally our body is pretty good at getting rid of it. But if you have things like overactive bladder or interstitial cystitis, painful bladder syndrome, our body doesn't do as good of a job getting rid of those. And when those oxalates accumulate into the bladder, we start to get issues and it gets irritated. So some things that are high in oxalates are going to be soy products, chocolate, dark green vegetables. If you go to this website here at the bottom, ichelp.org, they have a lot of good information on how diet can impact your bladder. I just want to go back to this picture really quick, just so you guys can appreciate how close the bladder and the rectum are to each other. So having issues with either the bladder or or your bowels can impact each other very closely just because of how close they are to each other anatomically. So pooping is very important, and it's important when you are pooping that you're not straining. If you're having issues with constipation and you're constantly straining, constantly pushing, that can lead to issues like pelvic floor muscle dysfunction, whether that be they're too tight or whether they're too weak, pelvic organ prolapse that can give you hemorrhoids. And then having this chronic constipation can cause urinary urgency and frequency and incontinence. So if you think back to that picture, if you're constipated and you have a lot of poop building up in your rectum, that rectum is going to expand, and that's going to mean that there's less space for the bladder to expand. The bladder is basically that big ball of muscle, and as it fills up with urine, it expands. But if next door in the rectum there's a lot of stool, that bladder can't expand as much, so it's going to tell you it wants to go sooner than it normally would because there's just not as much space to accommodate. So your poop likes water too. When you're constipated, a lot of times this can be caused by being dehydrated. So it's going to be a lot harder for your digestive system to process things that are very dry, and it's going to be hard to poop them out. If you think about when you're constipated, a lot of times you're pooping little tiny, rabbit pellets versus this nice formed stool. And that's because as your stool spends more time in your digestive system, primarily your colon, it's pulling out more and more water. So as it stays in there for longer, because you're constipated, you're not going as frequently, more and more water is being pulled out, and that's going to make it harder to go. So some things that you can take in that will help with poop are going to be fiber. So fiber can act in two ways. One, it can increase the amount of poop or kind of the volume that you have, and it'll help to soften the stool to make it a little bit easier to pass. The reason that it's important for you to have a larger amount of poop is if you think about a toothpaste tube. When you have a nice full toothpaste tube and you squeeze, it's really easy for something to come out. When you get to that little last bit, it's really hard to be able to get that last bit out just because there's not as much volume there. Same thing with your rectum and how pooping works. When you have a lot, it's going to be easier typically to pass it. So it's recommended for fiber that you get about 25 to 38 grams a day. But it's important if you're not getting a lot of fiber right now that you slowly increase how much you're getting. If you go from hardly any fiber at all to I'm getting 38 grams or more a day, you're probably going to get a lot of cramping and a lot of bloating, just general abdominal discomfort as your body gets used to it. So slowly increase the amount you take every few days to avoid that. When you are taking fiber too, you want to try to get soluble and insoluble fiber because they're going to work on the stool in different ways. So that soluble fiber, which an example of that would be psyllium husk, which is kind of a powder, or it's almost like pulp. You can add it to water, you can add it to juice, anything. That helps to actually absorb water into the stool. If you've ever used psyllium husk and you add it to something and you let it sit for a while, you'll come back and you'll actually find it's kind of this gel. That's how it works in the stools. It helps to kind of firm things up, but also draw that water in so that it's easier to pass. Insoluble fiber, on the other hand, will help work to bulk up that stool. Some examples that are going to be like wheat bran or vegetables like broccoli. They just help to add that volume so that there's more to push out so that we're not passing this little tiny marble through a giant hole. And when you're getting fiber, if you can, it's going to be better to get it through whole foods because then you're going to be getting lots of vitamins and other nutrients. But if you aren't getting enough in your diet regularly, you can find supplements like the psyllium husk. Metamucil is another one that you can add, to water, things like that. There's what's called the BRAT diet, which is going to be a high fiber diet, and it's full of foods that will help to thicken the stool and just help to create regular bowel movements. So this list here: bananas, applesauce, marshmallows, mashed potatoes, white rice, bread, cheese, peanut butter, raw carrots, peas, beans, and pasta will all help to thicken that stool so that it's a little bit easier to process without being super irritating to the digestive tract. Now, this is kind of a age-old question, I feel like. Should I eat breakfast? Should I not eat breakfast? I will say I think it's an individual thing, but when you do eat breakfast, that's going to help to stimulate what's called the gastrocolic reflex. So the gastrocolic reflex is basically just a reflex that our body has that helps to start promote digestion and get things moving throughout our digestive tract. And it's most active early in the morning and after a meal. This reflex actually turns off at night because we don't want to be digesting food very much so that we don't have to have a bowel movement in the middle of the night. Our bodies were not designed to do that. If you are pooping in the middle of the night uncontrolled, that's an issue. Um, but in order to stimulate this reflex, there's a couple different things that you can take in that will help to stimulate it a little bit more. So having something warm in the morning, like a warm coffee, the temperature of that will actually help to stimulate that reflex a little bit more just to get the digestive system turned on. If you have foods that are high in fiber, and then also just whole foods, that way we're getting lots of nutrients so that our digestive tract is working properly. I also wanted to mention a bladder and bowel diary. This is actually a copy of what I give some of my patients to fill out. The nice thing about these is you spend a day or sometimes a couple days keeping track of what you eat, what you drink, and at what time. And then if you're having bowel and bladder symptoms, you keep track of when you go to the bathroom, how strong of an urge you have. This one doesn't have the bowel component on there, but you would keep track of um, the size of the bowel movement. There's also what's called the Bristol stool scale, which helps you figure out what type of stool. So are you having this liquidy, almost diarrhea type stool? Are you having little rabbit pellets? Is it like a sausage? Is it like a ripe banana? There's actually different classifications of stool, and you would write down what kind you're having. Filling this out can help us to kind of correlate your diet with your bowel and bladder habits. So if you're having a coffee every morning and then that's when you're leaking, or that's when you feel this really strong urge to go to the bathroom, we can kind of use that to help modify your symptoms. I've also had a lot of people fill this out and they don't realize how much they're drinking or eating. So I had one patient who liked Diet Coke, but didn't realize how much of it she was drinking until she filled this out. And she was having like 4 or 5 Diet Cokes a day. And Diet Coke actually can be irritating to the bladder. So after she had a Diet Coke, that's when she was having her leakage and her urinary urgency, or feeling that really strong urge to go. When we cut that back, she was able to not need to go to the bathroom. She wasn't going to the bathroom every 30 minutes. So that's why this can be helpful. If you're interested in this, I'd be more than happy to send you a copy of this one. You can also just Google either bladder diary or bowel diary, and all kinds of different ones will come up. So that's kind of just a brief intro on how nutrition can impact your bowels and your bladder, and then ultimately the pelvic floor, because if you're having issues with your bowel and bladder over time, that can lead to pelvic floor issues, whether that be prolapse from chronic straining, trying to have a bowel movement because you're constipated, whether that be your pelvic floor muscles are super tight because you're always trying to hold in urine, or maybe they're really weak because they can't hold in that urine either. So does anybody have any questions at all?